us now is In Focus Health correspondent Lino MOUDOU. What do you have for us today, Lino?
Hello, Dimiake. Well, in this encore interview done earlier this year, I spoke to Dr. Luis Gomez-Sambo, the World Health Organization Regional Director for Africa. I asked him about some of the priorities on his agenda in addressing health on the continent.
HIV/AIDS is one of the major public health problems, but we still have malaria, we have tuberculosis, we have the neglected tropical disease, and we have the chronic diseases that are becoming more and more significant in terms of public health problem everywhere, and also the maternal and child health that needs to be improved, particularly maternal health. Maternal mortality is still very high in sub-Saharan Africa.
I would like to have your take on the Millennium Development Goals. Earlier this month, the UN has announced in a report that 3 out of the 8 goals have been achieved before 2015 with regards to poverty, slums, and water. Where do you think Africa stands in terms of reaching the MDGs by 2015? Do you even think that these goals are realistic for Africa?
Well, you know, I always considered the Millennium Development Goals as ambitious for Africa, but it's good to be ambitious. At least the efforts towards the achievement of these goals will enable some progress, and we should recognize that in relation to the MDGs, we realize progress in Africa, but not enough.
Can we maybe break it down per country or maybe per goal? If we do that, then are you optimistic whether it's about the MDG 4 to reduce infant mortality or maternal health, MDG 5? Do you think that there are some countries that show promise?
Oh yes, certainly. If we speak about individual countries, some countries are making progress and may even achieve the goals. In general, the progress towards the MDGs is not good enough in Africa. We need to scale up already identified public health interventions. It is possible if we put the resources, if we manage the resources efficiently, we could make more significant progress.
What do you see as the way forward with the MDGs?
Well, I think that it's a good idea to establish targets and goals to be achieved collectively in the world, because each one of the goals are very much relevant in the context of a human development that is an aspiration of any country in the world. And speaking about the health MDGs, in the African region, we realized progress. Infant mortality reduced in Africa. The burden of HIV/AIDS also is reducing. Not good enough, but we are realizing reduction in terms of incidence and prevalence of the disease and coverage of relevant services. Malaria is also making significant strides in African countries. So there are gains, very concrete gains, but they are not enough. At the current pace, it will not be possible African countries to achieve the MDGs in 2015, maybe beyond.
And that's all for today on the Africa Health Network. For more health news and development, be sure to visit our website at africahealthnetwork.com.